This is just the beginning.
Welcome to our Child Health in Lockdown virtual event. I'm Tina Reed, healthcare editor at Axios, coming to you from Washington, D.C. Thank you to the Children's Hospital Association for making this conversation possible on the impact of the pandemic on children's mental health. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join the conversation today on Twitter with @Axios and hashtag Axios Events. Over the next 30 minutes, we will unpack how COVID-19 has impacted children's mental health and what policymakers and practitioners are doing to create changes as they prepare children for life after the pandemic. Our discussion will touch on topics of depression and teen suicide rates that could be disturbing or triggering to some audience members. We would like to take this time to share information about the National Suicide Prevention Lifeline, reachable at 1-800-273-8255, which provides 24/7 free and confidential support for anyone in distress, in addition to prevention and crisis resources. Our first guest is the Senator from Nevada, Cortez Masto, who is joining us from Washington, D.C. Welcome, Senator.
Hello, Tina. It's great to join you.
So we're here today to talk about children's health, children's mental health in the midst of the pandemic. I know this is something that has been of special interest to you, particularly in the last year. Can you talk to us a little bit about what you've been hearing from constituents and what made you take a special interest in the issue of children's mental health?
Well, first of all, thank you for bringing attention to the issue of mental health for our children. But let me just say, even prior to this pandemic, addressing our mental health needs in this country and in Nevada was a priority for me. In Nevada in the 90s, we got and cut mental health, and we just never caught up. And then the pandemic hit. And what I was seeing and hearing from folks in my state is the impact this pandemic has had on them, the stressors on the family, stressors on individuals, and most importantly, the outreach that I have seen and received from family members or kids in general, really talking about the impact the pandemic has had on their mental health. And unfortunately, Tina, we've seen in Southern Nevada, kids taking their own lives. Say, as of February, 18 of our kids committed suicide. And really for me is understanding what is going on, what resources do we need to bring into our communities to really address the mental health needs of our students. So I really then started having a conversation with some of our kids around the state. I would have these Zoom calls and have some of our kids on the call from various areas throughout Nevada and talk to them about the challenges right now that they were facing as they were going to school, particularly through this virtual medium and dealing with the pandemic. And I will tell you, every single one of them, I don't care whether it was a rural county or really an urban county that we have, it was the same thing. It was isolation, high anxiety, concerns about whether they were learning what they needed to do as they were some of them getting ready to graduate and go to college, many of them feeling that they couldn't learn. They were having difficulty paying attention. And what did that mean? Are they going to be left behind that school year? I mean, it just went on and on and on. And missing out on extracurricular activities, missing out on being with their friends, right? And being able to relieve some of that tension, just being able to talk with their friends. So it really was an issue for me then to say, okay, I see it happening in my state. It must be happening across the country. How can we utilize the money that we're putting into these COVID relief packages during this pandemic and make sure some of that goes towards addressing the mental health needs and the well-being of our children? So that really was my focus. And when we passed the American Rescue Plan, I fought for mental health resources in that relief package. And then I know Nevada received over $1 billion to go to our schools, K through 12. And then I went back home and I met with some of our folks and just realized, you know what, we have to make sure that some of that money is focused on the mental health needs of our kids.
Can you talk a little bit about where precisely you think some of that money should be going?
Absolutely. I can tell you, I was able to go back I was born and raised in Las Vegas, so I went back to my old elementary school, which is still standing, and it's Doris Hancock. And I invited the state superintendent of our education department, as well as the Clark County superintendent, to join me. And the principal walked us through. This was a school that started hybrid schooling again. Some students were there and some were not. But I saw the benefits of really students getting back into schools. I also saw the benefit of making sure we're focused on their mental health and well-being. Doris Hancock had 2 social workers that were working in that school, looking out for the interests of the kids. But realizing we need to do more, we need more counselors. We need to make sure we have the opportunity for schools to work with community-based programs that focus on the mental health needs of our children and their families. I was able to sit down with our state superintendent and talk about how we ensure that this money that's coming into the state from the American Rescue Plan, how that money is specifically focused on addressing the mental health needs of our kids, and what she is looking for to identify from our counties in the school districts, how they're going to spend that money focused on the mental health needs of our children. And I will tell you, the other thing for me was just as important is making sure even now we're looking at additional funding for counselors. I've been pushing the administration and focused on making sure that we put additional dollars into 2 grant programs, about $500 million, 2 grant programs that just focuses on our counselors and making sure we're hiring more counselors for our schools, because this is the time to make sure the money's spent in the right way, the best interest of our kids.
You talked a lot about using the schools as a vehicle for getting help to kids. Why do you think that's the best way to move forward, helping get this help to kids? And is there another vehicle you think could be helpful as well?
Well, the first step for me was all this money that we fought for to get open our schools again, making sure as we came out of this pandemic and got more shots into people's arms and the vaccines, and we could open our schools safely, was to ensure that the money is spent for the best interests of not just our students, but the staff, the teachers, everybody there, right? But here's the thing. It all is local, and that's where it starts. If our local school districts, if our state Department of Education are not focused on what's a priority and how they're spending this money and ensuring some of that goes to mental health needs of our students, then no, the money will not be spent in a way that I intended it to be when I voted for this package. So that's why it is important and was important for me to actually go into my community, go to a school, talk to the principal and the teachers and the social workers and the counselors, and be there with our folks that work in our State Department of Education, as well as our superintendent of schools at that county. I think it is important. They have a role to play. They also have a role to play when it comes to building a relationship with community resources outside of the school district. There are many resources that can provide essential services to our students and their families based on their behavioral health needs, and we should be open to that happening as well.
About how many counselors do you think we need nationwide to meet the needs that are out there? And is there a workforce that's there that can fill that need?
Well, I'll tell you what. My sister is a counselor at a school in Nevada, and we do not have enough counselors, and we have to build that capacity. And so that's one of the reasons why I support putting $500 million into these 2 grant programs that are just going to be focused on ensuring we are building that capacity for our counselors across this country. Is that the only answer? No. And that's why I think we also have to be able to make that connection between those community-based services that are focused on behavioral health. There's a role for them to play. Working with our county, our school districts to ensure that we're providing all of the resources and the tools that we can to the best interests of our kids.
When you talk to students and families and superintendents, what do you think the long-term impacts of this pandemic are ultimately going to be on our children?
Well, that's just it. We don't know. And that's why this period of time for me is crucial. We now have to, we've got the money that we've pushed out through this COVID relief package and getting relief into our schools. Like I said, I voted for $122 billion for education. $1 billion of that is going into the state of Nevada. Now's the time to start focusing on the mental health and well-being of our kids, not just now, but as we're opening our schools and they're back in their schools, which I think is important for the mental health needs of our kids, that we now focus on what those impacts are going to be. I think we're learning that right now, and we have to be prepared to understand it and provide the resources that are necessary long-term.
Well, thank you very much, Senator Masto, for joining Axios today. I really appreciate it.
Well, Tina, thank you. And thank you for highlighting this important issue. Really appreciate the opportunity to talk with you.
And next, we have a View from the Top segment with my colleague, Senior Vice President of Client Partnerships at Axios, John Otto.
Thanks, Tina. I'm John Otto, Senior Vice President of Client Partnerships here at Axios. And now joining us from Washington, D.C. is the President of Children's Hospital Association, Amy Wimpy-Knight. Welcome, Amy.
Hi, John. Thank you. Thanks for having us, and thank you to Axios for hosting this event.
Oh, I'm looking forward to our conversation today. So, as we've learned over the last year, thankfully, children have been largely spared of the most severe symptoms and outcomes of COVID-19. But there is an increased reporting about the pandemic's toll on something completely different, and that's children's mental health. But could you break this down for us some more?
Sure. I think your point is spot on. So we certainly have seen children be impacted by COVID from a physical sense. So they have been infected. Many of them have gotten sick to varying degrees, and some have actually gotten severely sick, like many adults. Fortunately, they have been spared quite a bit. A piece that we've largely ignored to date is really the impact on their mental health and how that's impacting kids overall. So if we think about the consequences of the past year and the social isolation that occurred, the family stress, the financial stress, the lack of school, the lack of structure for many of these kids, they've been significantly impacted by that. So what was already a little bit of a challenge beforehand, we've seen the increase in mental health issues in children over the past decade rising quite significantly, has really become a full-blown crisis as a result of the COVID-19 pandemic. And how we think about that now and how we think about that into the future will be incredibly important for our healthcare system.
And your organization is working with over 200 children's hospitals across the country right now. What are your members seeing on the front lines of the emergency mental health care situation?
Sure. I think when you think about children's hospitals, it's not something you always equate with mental health services. You often think of a therapist or perhaps someone that you can talk to. So children's hospitals are on the front line in a really different way right now. As we talked about, the crisis is extreme. And so what you see in that is rather than children being cared for in a community or perhaps being identified as struggling, if you will, in school, they're actually, it's exacerbated their symptoms. The delays in cares that have resulted in a pandemic means that many children and their families are actually coming to hospital emergency room departments right now. In fact, in some places, for example, in Jacksonville, Florida, at Wilson Children's Hospital, they've seen over a 300% increase in mental health admissions. What that means is that you've really overrun the system of care. It's not a place that we should be taking care of children's behavioral health conditions. We should be far removed from that, dealing with it in the community, dealing with it in a primary care physician's office. But those have been inaccessible for children during this time. So you will see really in any hospital, children's hospital from Boston to Los Angeles to Denver, 30 or 40 children who have presented with suicide ideation. They may have attempted to harm themselves or sitting in medical surgical beds waiting for a psychiatric bed to open or a mental health bed, whether that's at the children's hospital itself or perhaps in a behavioral health provider in the community. They're all at capacity right now, and children are crossing state lines and far away from families to receive the care they need.
And if we could zoom out for a minute, how has the mental health crisis for children evolved over time?
Sure. If you look at it, we really didn't identify very well that 50% of mental illness develops in its early stages in childhood. So I think we missed that opportunity to intervene for a long time, not because we didn't know, the science just wasn't there. And so as we've been able to treat kids earlier, to work in areas of prevention and surveillance, we've also destigmatized behavioral health services to some extent and children who are struggling. So, oftentimes we talk about a child with diabetes or with asthma, and we understand very well that if we intervene early with that, we have an opportunity really to improve their outcomes, not only in their childhood or in their youth, but really over their lifetime. So we're arriving there with behavioral health now. And so sometimes what isn't necessarily a disorder at its onset, we're able to treat earlier. So we've seen a huge rise. Obviously, the systems of care have changed. The pressures on kids are enormous these days, from academics to social media to otherwise. And we've all seen the research on that and are following that very closely. But what that means is we've seen the numbers increase like 2- and 3-fold over the past decade in terms of number of children presenting with suicide ideation, perhaps an eating disorder, a lot of depression, anxiety in children and youth. And ironically, the ages are getting younger. So, recently, suicide became the second leading cause of death in children under 10 to 14. So we're seeing this happen younger. And the pandemic has really just shown an unfortunate light on that in many ways because of the pressure that kids have been under, either in their home environments or just the lack of structure. When you don't see friends, you don't see teachers, people that provide you an outlet, it's become incredibly difficult for kids to thrive.
And, now from like a policy perspective, what are some of the things that policymakers can do to help address this crisis? How can they support, confront this?
Sure. I think one of the biggest issues is just recognizing that this crisis exists. We talk a lot right now, and we're thinking a lot about what we call long haulers and adults. And so these are people that will have symptoms for years to come. They're oftentimes visible symptoms. We need to think of our children in the same way. They may not have been infected by the virus, but they have been impacted by the virus. And their experiences will be long haul symptoms in many ways. Children who may be fine today, as they re-engage in school in the fall, may be very different. So from a policy perspective, we really think we need to strengthen the mental health care system for children. And our bill is actually called Strengthening Mental Health Now. And what that really aims to do is two things. One, create additional capacity to take care of kids. That is not necessarily always in children's hospitals. That may be in a community setting. It's certainly, there are things that can be done and should be done in a children's hospital, from being ready for the next crisis to actually being able to have day programs and things of that nature where kids still can live their normal lives. But working with primary care physicians, working with psychologists, we're not going to train our way necessarily out of this. So we need to make sure we have the continuum of providers who are available to children right into the schools. And so creating that infrastructure nationally to be able to do that is incredibly important. It's an area that has been underfunded for many years. And our aim is to bring attention to it and make sure that policymakers think specifically about children when they think about behavioral health.
Well, Amy, we're going to have to leave it there. But thank you so much for the time today. Amy Wimpy-Knight with the Children's Hospital Association. I really appreciate your time.
All right. Thank you, John.
Okay. And again, a special thanks to our partner, Children's Hospital Association, for making this program possible. Now back to my colleague, Tina Reed.
Thanks, John. Our final guest is the founding president and medical director of the Child Mind Institute, Dr. Harold S. Koplewicz. He's joining us today from New York City. Welcome.
It's a pleasure to be with you.
Well, tell me a little bit first about what the Child Mind Institute is and a little bit about what you've been seeing when it comes to children's mental health in the past year.
Well, the Child Mind Institute is an independent nonprofit that's located in both California and in New York City that is dedicated to transforming the lives of children and families who are struggling with mental health disorders. We do that by providing gold standard care, by providing new research that's open science, so we share our data before we publish. And most importantly, we do a lot of public education and public awareness, which means that we're helping Americans recognize how real, common, and treatable mental health disorders are in kids and adolescents.
Can you tell me a little bit about what you've been seeing in the last year as it relates to adolescents and children and their mental health in the midst of the pandemic?
Well, the coronavirus has been a remarkably bad event for kids everywhere, meaning that even the 60% of kids who are happy-go-lucky and resilient are feeling the stress of coronavirus because they had to do distance learning. They were stuck in the house. The 15% of all kids who are subclinical, meaning a little too quirky, maybe a little worried, a little inattentive, they're more symptomatic. But the 20% of kids, the kids who on a good day in America, the 17 million children, the 1 out of 5 kids who have a mental health disorder, those are the kids who are struggling the most. Those are the kids who, if they had a pre-existing anxiety or mood disorder, they're more likely to have depressive symptoms right now. And the biggest switch that we've seen is that while we saw 200 kids a day in person before COVID, we're seeing 310 kids a day on a screen and 30 in person. So the demand for psychological services in kids has really exploded. And I think that might be a good thing. That might be the silver lining of COVID, that telemental health works and that parents have been observing their kids in a school-like setting, but at home, and are starting to recognize that some of their kids really are experiencing distress and dysfunction.
I'd like to drill down a little bit. Why are they experiencing distress, or what's unique about their experience in this pandemic?
Well, I think that if we think about everyone who suffered from the pandemic, the kids who took the biggest losses were 13 to 24-year-olds. Those are the kids who not only had learning loss, but simultaneously they had psychological loss as well. The first date, the years of training to finally make the football team, the child who wanted to get a lead or get into the chorus of the school play, those things are gone. They can't get them back. And for the rest of us who are adults, well, it's been a terrible experience, but it's a little blip in a long life of a 40-year-old, 50-year-old, or a 60-year-old. So 13 to 24-year-olds are taking a hit by the fact that academically it was a very challenging year, but psychologically the losses for them have been great. I think if we think about 5 and under kids, most of them are not saying, oh, I wish I was in daycare. I think they're having a very good time spending so much time with mom and dad. And the 5 to 12-year-olds, they're having a lot of challenges with Zoom or distance learning, but they will make back those academic losses very quickly because the brains of kids and teenagers are much more resilient than the brains of adults.
So what are your expectations as we finish up this school year and look ahead to the school year in the fall, where a lot of folks might actually be going back in person?
Well, let's hope that we have a new normal and that in September school will be open. I am concerned that there's a good 20%, a very significant minority of kids who are not going to go running back to school. Those are the kids who pre-COVID were a little more anxious on Sunday nights and Mondays, had trouble with sleepover dates, had difficulty after a school vacation to get back to school. Those are the kids who are somewhat pathologically self-conscious, also in school, more sensitive to any kind of bullying or slights, kids who have some obsessive compulsive symptoms, and also a group of kids who are going to have PTSD. So those kids are going to need extra help. And what we really are hoping for is that teachers can get a new set of tools for their toolbox on how to handle kids with anxiety symptoms. Because anxious kids don't always look, don't always look isolated or worried. Sometimes they can be very oppositional and defiant and distractible. And while we don't think schools should be mental health facilities, we do recognize that mental health disorders are barriers to learning. And unless we help teachers and parents prepare, we're concerned that there's going to be a long psychological tail to COVID when kids have to return to school in September.
Let's talk about that a little bit. What should parents and teachers be thinking about? Let's start with parents first. What can they be doing to help their kids?
So I think parents have to remember they are going to be scaffolds. They are going to provide support and structure and encouragement, but they can't do their kids' homework. They can't go to school for their kids, but they do have to listen. And they also have to understand that failure might be an option. It might not work out. And if it doesn't, that's okay. We're going to brainstorm. We're going to figure out how you can take the next test with greater ease, or how you're going to run the race the next time with more effectiveness. And that's what's going to happen with preparing our kids for school, making sure that They go, if you know that your kid's a little anxious, now is a good time to reach out to the school and say, can you call on my kid more often on a Zoom class to get him prepared for the anxiety of being called on? It's a good time for parents to maybe even have a soccer practice in school, or take your kids to the track if they're runners to see if they can get back into the swing of things. So exposure, response, prevention. See if we can expose them to things that might make them anxious just a little and show them that they're going to be able to overcome their anxiety.
And now what about teachers? What sort of tools do they have in their toolkit?
Yeah, so I think teachers, and I say this with the greatest respect, they're overwhelmed. They're just overwhelmed. And this has been a remarkably hard year. And for me to say they need more tools might be overwhelming, but nevertheless will be helpful for them. If they can have more classroom management techniques, for instance, catching a student being good, making sure that you say, thank you for raising your hand. No, that's not the right answer, but I really appreciate that you're following the directions. And trying to do that 3 times for every time you say something corrective is really quite wonderful for all students, but particularly for anxious kids who want to please the teacher. And I'd also tell you that routines work. Parents can use the routines, teachers can. When you get back to school, there's the morning routine, there's a routine around lunchtime, there's a routine after lunch. Those things make anxious kids feel better when there's more structure. And so most teachers take it for granted. I would tell them, double down on all the routines that make kids feel more comfortable, and also keep your eyes out for kids who are showing, distress and dysfunction, kids who seem more socially isolated, kids who are more irritable, kids who tend to be all of a sudden oppositional and defiant, who routinely aren't. Don't hesitate to ask for help, because we know that these things are very treatable. We know that with slight management techniques, we can get improvement in symptoms. And if it's serious, we also know the treatment works for kids with mental health disorders.
You talked about there's a 20% that might not be looking forward to going back to school. What about the majority of kids who might be looking forward to going back to school? What might they experience in the fall that might be unexpected?
Well, I think it's been a long year. And for many of them, they haven't been back to school. They might have expectations that are not realistic, such as following rules, such as not getting dressed in the morning, brushing your teeth, making it to school on time. There's a whole bunch of organizational skills that they're going to need. But by and large, the overwhelming majority of kids are hungry for the social interaction and for those wonderful opportunities that school offer us, whether it's playing on the baseball team, learning history, doing an art project, or just hanging out with friends at lunchroom. And for most of those kids, this is going to be a seamless, wonderful experience. But let's remember that they still are going to need help with some organizational techniques that they started not to use because they just rolled out of bed and turned on the screen. So parents just have to be aware, and teachers have to be aware, that even for the healthiest kids, a little bit of adjustment most probably is necessary.
And long term, what do you expect the largest impact of this pandemic time will be on kids' mental health?
So we've seen when we've had other tragedies like 9/11, that it actually took quite a while for a certain percentage of the population, particularly those who knew someone who died or someone who was injured, to come back from this, the grief, the mourning. And so I think we have to remember that nearly 600,000 Americans died, and the ripple effect for that, particularly for children, could be quite significant. So we should be looking for the signs and symptoms of anxiety and depression and not ignoring them, intervening so that a kid can get back on the road to good mental health.
Well, thank you very much for taking the time to speak with us today, Dr. Koplewicz. I appreciate it.
It was my pleasure.
And thank you all for joining us this afternoon for another virtual conversation that has made everyone smarter, faster. Thank you to our sponsor, Children's Hospital Association, for making this event possible. To sign up for Axios Vitals or other newsletters, visit axios.com/newsletters or check out the Axios app. Thank you all for joining, and we'll see you next time on axios.com.